recently because Mr. Jackson buys these readers over the counter. He has magnification glass. He can.
If you lose one, you just replace it.
He has magnification glass. His eyesight was very, very bad. I decided to figure out he could be legally blind. His eyes was also very red. I asked him about glaucoma to see, because I'm trying to take care of him in general. And he says no, he doesn't have any glaucoma. And even when I spoke to him at that time, he never told me he was seeing a doctor that had given him any substance like that for the eyes. Just last week, I got this doctor from UCLA to see him. Last Sunday, they were going to open their clinic to do a complete dilation, look in the back of his eyes, check his fundus, and see what was happening, and see if they were going to give him any monocular vision or contacts, because I was worried that when he was in England, if you're not seen on the stage and all the bright lights, maybe you can fall and hurt yourself. So I encouraged them and him to have the eye examination. That eye examination was hopefully scheduled for last Monday.
So he had agreed to it?
He agreed to do it. But it never happened. I still have email from the doctor asking me to call and reschedule it. And one thing or the other led to that being put off. But his team, his production team, agreed that it's something that he should have done. So I was trying to find out issues with Mr. Jackson and trying to address them in a gradual way overall to help him. And that was one of the things I discovered. So that medication is a surprise.
How about Balisone?
Balisone?
Yeah, it's a steroid cream.
Almost like a Vaseline.
Oh, no, I don't know about that.
Okay.
No,
for like some type of inflammation of skin?
Well, I'm told that Dr. Klein is maybe a dermatologist. I don't know. But his production team had said to me recently that his worst days on the set is when he had gone to Dr. Klein's office, which is about 3 times a week. And when he came back, he was basically wasted and required at least 24 hours for recovery. Now,
is that Arnold Klein?
I don't remember. K-L-E-I-N.
Beverly Hills?
Yeah, Beverly Hills. So I wasn't certain, again, why he never shared with me. If you want me to be your team and overlook things for you, why would he have shared with me the fact that he was seeing a dermatologist or another doctor for any kind of treatment that he did not share? The only time I got hold of the activity trying to get into the clinic, that day when he said he had to go, it was very important. He was insisting on that. That's when he called around noon to that place, asked for Jason, and tried to see if he could be squeezed in.
How about Benoquin?
Benoquin, yes.
Okay, some that you prescribing? Okay.
What is it?
Benoquin, 20%.
What is it? What does it do?
It's a cream made for bleaching or permanently removing spots that will accumulate on the skin. Like, for example, if one has vitiligo and you have blemishes on your skin, like dark or white spots that may develop, you can use Benoquin. It takes about 9 months of therapy. It's a very safe agent, and it can permanently remove the spot.
And we already covered the prior injection marks. That was something that you noticed yourself in your examination, and caused for his veins to harden and make more difficult to find.
Phlebitis.
Yeah.
And that's another reason why I thought his cause of death could have been a pulmonary embolism or a blood clot migrating to his lungs.
Produces irreversible depigmentation.
That's why I said permanent.
Can't get down.
Now he also has something called hydroquinone, which is 8% cream, which is used for temporary removal of spots. It works more quickly, but it's not permanent. So he would use both in case there was a blemish. He would follow the 8% with the 20%. And, when the spot went away, he would then try to continue using the other one, so he doesn't.
We found a small portion of marijuana in his room. Did you know him to be a smoker?
No. Marijuana?
Which room? The one that you don't go into, or?
Yeah, the one you stay out of.
Yeah.
You don't go.
No. He denied so clearly. I felt, now that I'm finding out all of these things, piece by piece, I gave Mr. Jackson love. I was his friend. I cared about him. I tried to help him. That's all I was trying to do. And I feel let down to know that, he would be using things like that.
Well, the marijuana we found was old. It had already rotted away.
Oh, it rotted away.
Yeah.
It was in a suitcase, in a closet, buried. Family members came across it when they were cleaning.
So, it wasn't like a fresh joint or anything. It was something that had
who knows?
rotted.
I doubt that he would even pack his own suitcase when he went away. What about cigarettes?
No, he packed his suitcase.
Did he?
Yeah, I know that for a fact. He packed certain
Clothes
suitcases.
or other things?
He would pack certain suitcases that he went away because he would be familiar with where certain things would be, and he would want to know that and keep that exclusively to himself.
What about cigarettes?
I don't know to smoke. He found cigarettes.
Empty packs.
Really?
In the same suitcase that literally it was raunchy, old, you couldn't even tell it was marijuana. In fact, we thought it was initially tar heroin. When we had it analyzed, and it's just decomposed basically marijuana, and the THC was present. But nonetheless, there was 2 empty packs of cigarettes in there. I know his family is definitely against that.
Wow.
But again, who knows?
But at the same time, no one went into that room. He wouldn't let anyone in. But he used excessive cologne, and I never understood how he sprayed that much on all the time. I'd be saying, and he just keeps spraying. And it could have been to dismiss any odor. I don't know.
Mentioning some doctors, we talked about a Dr. Lee.
Yes.
And was she in Vegas?
No, she's here in California.
Where at? Do we know?
It has to be Los Angeles because this is where apparently she was coming in and giving infusions at different times during the week. That's what he told me.
And then there was also the Dr. David Adams. He's in Las Vegas. Mm-hmm. We talked about a Dr. Klein, possibly an Arnold Klein, in Beverly Hills. And then a Dr. Metzer.
In Beverly Hills too. That's what their prescription bottle says Beverly Hills. I think if you have the medication with you can look at the medication bottles and you'll find out.
How do you spell Metzer?
I think it's M-E-Z...
M-E-T-Z-E-R?
Something so. I think that's what I saw in the bottle.
Metzer?
Yes.
Yeah, it's Metzer with a G.
M-E-T-G-E-R?
Yeah.
Is that correct? I wonder.
What's H for you?
I saw it on the bottles of medicines at his bedside. So if you look at the bottles, you'll see the doctor's name on it.
Like M-E-T-Z-G-E-R?
Yeah. With, you see the prescription bottles.
The evening that this was going on at Mr. Jackson's house, his final night, these different syringes, or one syringe was used when you injected it into his IV drip down below.
Yeah, one syringe for that, yeah.
I'm sorry?
Yes.
One syringe was used for the various medications you gave him, or
no,
each time was it a...
No, I had 2 syringes, and I would recap them if I needed it, and I would use the medication and I would draw some saline to have the mix, and then I would infuse it. Yeah.
What did you do with those syringes when you were done?
But I usually have my bags right there, and everything I use, I would put it quickly into the bags, and I just put it into the cupboard, because he wanted me to not have anything hanging around.
Where's your bag where those syringes would be at now?
Oh, really?
I don't have that.
I thought you left it there.
Yeah.
Where did you leave it?
In that same bedroom, in the closet where it always stays.
Which closet?
It's
a mess.
45 cupboards.
Yeah, if you walk into the dressing room and you turn right, The high level top. The bags left there with the items in it and the medication.
Is that the closet that has the glass cabinets with his jackets?
Yes, but this would be two short stubs higher up there. He showed me that cabinet. He wanted me to keep the things there with my bags and so.
And that's where you left your bags that night?
Yeah.
Black?
3 bags. There were 3. One is a little Costco blue bag. One is a black small bag. And then one is a little blue bag that has a zipper in it.
And you left it there because you went directly with the EMTs to the hospital and never went back to the house, right?
Oh, but it would have stayed there anyway until I came back the next night and helped him. Because, it has the IV cartridges and everything is in there.
And that was normal course of business for you, nobody?
Yeah.
Can you think of anything else?
I'm thinking that's about it. Okay.
Do you happen to have the key for the car? So I don't have to break into it?
No, don't break in the car.
Oh, we have to get into it.
But you didn't open the car yet? It hasn't been opened?
Oh, no, it's just been locked. So,
Really?
yeah, we didn't have a key for it.
I don't think I have the key on me. I hope I do.
That way, whoever comes,
yeah,
make sure
definitely.
they have.
Do we need a safe word for that? No, please.
Okay. It'd be easier if we had the key. That way, we could, not damage anything. Because sometimes when the guys
Or
lock,
you can
they
get a key,
disconnect.
an extra key.
Yeah, well, I have the one key here, and I don't know if Jack
We
has
got
the
what?
key.
Did you ever give them to him wrong? Okay.
I don't find any.
Yeah, we didn't find any.
But I
don't know
know
how
there was a zip.
That concludes the playing of the audio. 197. Mr. Walgan?
Detective, does that audio recording we've heard accurately recount the interview that took place at the Ritz-Carlton on June 27th, 2009?
Yes, it does.
Prior to that interview of the defendant on June 27th, 2009, to your knowledge, had the defendant informed law enforcement he had administered propofol?
No.
So that was the first you learned of that?
That's the first time those words were uttered, yes, during our interview.
And prior to this interview, you had reviewed the brief statement made by the defendant to Detective Porcher that was referred to in the interview?
Yes.
And in that interview, the defendant stated he gave a sedative?
That's correct.
Okay, but did not mention propofol?
Right.
Now, you described when we were here last week that prior to conducting this interview, you had responded to UCLA. You also mentioned attending the autopsy. And I believe you mentioned your knowledge was fairly limited as to what had transpired on June 25th.
Very limited, yes.
Can you describe this interview? In other words, in hearing the interview, there's very little questioning by you and Detective Martinez. Would you agree with that?
Yes.
You ask about certain medicines, you ask about certain doctors, but as far as the